Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, we're back and excited talking about our Gold Lactation Online Conference 2025. And I'm absolutely so excited to introduce to you once again, Catharine McDonald. Welcome back, Catharine. It's so good to have you here at Gold.
Thank you, Fiona. It's so wonderful to be back for another conference.
Yeah, absolutely. Now, you're talking about something that, I feel is so important. It
Mhm.
should be a given. So, trauma-informed lactation care, principles to
Yes.
foster safety and reduce harm is the title of your presentation. So,
Yes.
let's get into it a little bit because, first of all, I always ask the why. Why this topic? Why is this important to you personally?
Yeah.
And tell me some of the things that you've discovered on this journey.
Thanks. Yeah. So, as a reproductive mental health therapist, I encounter many individuals who are on a pregnancy journey or newly postpartum, many of whom have lactation goals around their birth experience. And time again, I have seen the need for collaboration between mental health professionals and IBCLCs and education for IBCLCs to better understand what past traumas can do in the lactation space, what impacts there can be, and how in turn lactation consultants can use trauma-informed care principles that we apply in all different places in healthcare to best serve clients and avoid unintentional reactivation of trauma or perpetuating trauma so that the person who is hoping to baby feed can do so without adding to distress for the parent baby unit.
Yeah, I absolutely love that because this is something that is often not spoken about in the lactation field. And
Mhm.
to be honest, it's not always something that a family is able to open up about or is not even focused on themselves because
Yeah.
often when they come to lactation consultants, there is a need for care and it is very focused on sometimes just transferring milk from an infant to a baby. So in that urgent sense, it's sort of the
Mhm.
minuta of the, say employment of an
Mhm.
IBCLC or a lactation counselor is that is the dire sort of need in that moment, the acute
Mhm.
need. So it's
Yeah.
interesting how when we start looking at it further, that we notice that sometimes when things are not working, we have come to understand and recognize it could be because of this, because of a particular trauma. And yet we may
Mhm.
never know, and we don't need to know, do we, what it
Right.
might have been.
No, and a person doesn't need to disclose what their trauma is to be treated compassionately with trauma-informed care.
Right.
And a truly trauma-informed approach involves treating all individuals with the assumption there could be a trauma and I don't want to make that worse. How can I
Mm,
approach each and every person that I serve, whether you call them patients or clients, with
hmm.
compassion, be with respect, with support of bodily autonomy, employing great consent, and being thoughtful that we want to make sure we remember that we don't know what somebody has lived through before they come into our space. And over the years, I've developed really positive, strong working relationships with IBCLCs in my community who do provide trauma-informed lactation care. And that was a big inspiration for this presentation. I collaborated on with Vanessa Janik, an IBCLC who provides really fantastic trauma-informed care, often pulling from her own expertise working in the labor and delivery world.
Mm.
There are many points at which people's past trauma can be reactivated, and we share a passion for lactation and supporting postpartum folks feeding their babies. And so we want to make sure everyone who wants to do that can successfully, not at the expense of their own mental health.
Yeah, absolutely. Now, I'm gonna challenge you a little bit, I think, Catherine, because I know there's
Oh,
going to be people listening in and saying, "Well, I'm very gentle, I'm very nurturing, I'm very compassionate when I go
mhm.
in with my, clients."
Yeah.
What is the difference really from, the side of things where we've always worked with, an open heart and an open mind, but what's the difference when we start to look at trauma informed? And how might that benefit moving forward in our careers?
Well, that's a great question. I think it's so important to acknowledge that I come from this place of assumption that everyone who gets into lactation does so because they care. They
Mm,
want to provide the support that postpartum people need to feed their babies successfully. So they're
mm,
um, I have yet to meet a lactation consultant who's in it for the money or the fame, right?
Right. Yeah.
It is a vocation of service, and many people feel called to it
Right.
through their own lived experience or their own family experiences. So everyone comes into this with good intentions, but we don't know what we don't know. And it is
Mm-hmm.
impossible, even as a seasoned licensed mental health professional, I can't know all the possible things that every person who walks in my door might be holding. And
Mm-hmm.
I only know what they share with me.
Right.
And beyond that, sometimes months into working with a client, I learned something and the client goes, I didn't know that was relevant. I didn't
Right.
know that was there. And I think that if we think about the busyness and the exhaustion, physical and emotional and mental of the early weeks and months postpartum, there's probably a lot not on the postpartum person's radar. They're
Mm,
not thinking about 5 years ago, 20 years ago, when I was a child myself, how might that be playing into this moment? And
mm.
so there's just no way for any of us professionals, whatever the discipline, to prepare for all the possible things that could be
Right.
challenging or reactivated. And we don't want to inadvertently put the work on the client
Mm-hmm.
to know of that, be aware of it, and say, oh, that's going to affect me in this moment. So
Mm-hmm.
when we take a trauma-informed approach and treat everyone as though they may have traumas that we don't know what those might be, and we just do a really great job. I think of it as overachieving, aspiring for
Mm,
the A+ grade in consent, in letting the client lead and offering our guidance as opposed to taking an expert role and saying, you have to do it my way, or I'm going to show you the way that we can
mm.
make it safer for them to come to us for support or to say, this isn't working. I need another way.
Mm.
And then,
Client-led with consent. Mm.
yeah.
I really
Mhm.
appreciate that. I'm going to ask you a question, but I feel like we should answer it, during our time together because I
Yeah.
think, when we do the live presentation, but it just came to my mind that we do a lot of intake forms
Mhm.
with our clients, when we're working with them, because we want to get a
Of
baseline
course.
on what is happening. It's very common in the medical field to do that. However, the perspective of we actually could be re-traumatizing families, even with an intake form. Now,
Mhm.
you can maybe answer a little bit to me, but I think this is a bigger conversation. We can carry it over to our conference. But
Mhm.
is that something that you've changed over the years, even yourself? Have you seen that change in others?
Over time, my intake firm has grown quite extensively, not just in length, but evolving. And as I
Mm,
learn and grow, and over a decade into my private practice in reproductive mental health, I'm still thinking of how I can grow and I don't know what I don't know.
mm-hmm,
So someone is going to teach me. And I think that there are some things that I've learned I don't need to ask. There are some
mm,
things I've learned over the years that people are not going to answer if I put in writing. There are some things
right.
that I don't want documented in writing. And then I've also added in little invitations. Share what you feel comfortable
Mm,
if you wish to share. Is there anything else I should know? The open-ended curiosity
mm,
has become a really valuable tool. And that's one of the many ways that we can step outside the box of the this is how we do it here idea. Well, we've always
right,
asked that. My mentor
right.
told me they ask that, so I ask that. And stepping outside and thinking, is that the best way to support someone? Is that the best way to create safe space?
Mm. I, well, my goodness. This is gonna lend into a bigger conversation, I think, when we come back together. Some great points there. And yes, I think that we hear that a lot. We've done it this way for so long, and so
Mhm.
why, mess with something that's working well? But the question always is it actually working well? And how are we making sure that we're including consent of our families and making sure that they're leading that process? Absolutely fabulous. Thank you so much for being
Thank
here
you.
today. Love having you here at Gold, and I can't wait for your presentation, Trauma-Informed Lactation Care, Principles to Foster Safety and Reduce Harm by Catharine McDonald. I can't wait to come back and have you be here for the live event. Now, Catharine is going to be here live, as I mentioned, which just means that you'll be able to join
Yeah.
in the conversation, and be part of the live Q&A as well. So take advantage of that. You can find out all the details on our website at goldlactation.com. You can register for this event and, of course, the entire conference, as well as if you're listening and you're going to be with us for the recorded version, you will have access to our forums as well, which means that you'll be able to ask all those questions that you might have in part of this community here at Gold. Thank you once again to Catharine McDonald for being with us here today. And of course, to all of our viewers listening in, we appreciate you and we'll look forward to seeing you all very soon. Bye bye for now,
Looking
everyone.
forward to it.
Bye
See you
bye.
soon.